Welcome to the Evolving Past Alzheimer's podcast, where we are focused on bringing you information to help prevent and reverse brain diseases like Alzheimer's and other dementias. I'm Dr. Nate Bergman, a functional medicine physician in Cleveland, Ohio, and your host on this journey. So, whether you're a baby boomer who's worried that your brain wiring just isn't working like it once was, or you have loved ones with the disease, or you yourself have already been diagnosed and are wondering, what do I do now? You'll want to listen to this podcast. Each episode, we introduce you to the top doers and thinkers that are revisioning Alzheimer's and dementia. If you have questions or comments or just want to connect, please check us out on our Facebook page, or if you're old-fashioned like me, Google Evolving Past Alzheimer's Podcast, and you'll find us that way. So here we go. Let's get better. All right, welcome back to the show. Today we have a very special guest. He is a neurologist who did his medical training at both Harvard and Johns Hopkins, where he maintains an academic affiliation. He has pioneered work in demonstrating improvement in critical areas of the brain associated with memory loss and Alzheimer's disease. His work has been featured in Time Magazine, Reuters, and he's been seen on PBS, CNN, NBC, ABC, Fox News, and on and on. He's the author of 3 books and multiple academic as well as popular scientific articles. He's a personal friend of mine and a brilliant leader in the field of brain science, and I consider it a privilege to know him, and I've learned so much from him and his writings. Please welcome to the podcast, Dr. Majid Fotuhi. Hello, Majid. How are you doing?
I'm fine, and thank you very much for that kind introduction.
Well, let's get right into it. What interested you about getting into the field of neurology and brain health and brain science, and how long you've been in the field?
I have been in the field of neurology for approximately 20 years, but my interest in brain began when I was 7 or 8 years old. My father used to tell me that there is no limit in how much our brain can accomplish. And he brought to my attention a child who did not have arms and had learned to make the most beautiful drawings with holding a pen between her toes.
Wow.
And she said, you never think that your toes can make such beautiful, detailed miniature drawings, and they can. And you have this amazing capacity in your brain, and it would be great if you use it. And so since early childhood, I was interested in brain plasticity. And in college, I became more interested. I did some research at McGill University and fell in love with the fact that our brain can change, that our brain, the very organ that controls our behavior, our language, our satisfaction with life, is not fixed. It's malleable and it can change. So I remained fascinated, and I went to medical school, and of course, I went to a neurology residency, and I see patients with neurological issues, and every day I enjoy what I do because I really find this topic interesting.
Wow, that is really a good story. So you mentioned the brain being plastic or having plasticity. So is that the concept that the brain can sort of change over time? How do you define plasticity of the brain?
So you know that if you exercise, your biceps can grow bigger, and you also know that if you hospitalize and you don't move your limbs, they can atrophy, they can shrink. So the size of your muscles is not fixed. There's some general size, but there's some variations. Your brain is somewhat similar in that it has capacity to become a little bit bigger or a little bit smaller. And we used to think that this change in the volume of the brain can only happen at the microscopic levels with changes in the number of synapses or maybe a few fiber bundles. What is exciting these days is that we have discovered the changes in the brain can be so humongous that you can see them with naked eye on brain MRIs. So brain plasticity means the brain can change for better or for worse. And it's something that happens to us every day. And if you have too much of any one thing, then your brain can grow a lot or your brain can shrink a lot. So this is the concept of plasticity in the brain.
Wow. Yeah. So that's actually, I remember you talking about that. I met you a couple of years ago, when you came to Cleveland to be part of an expert panel on neuroscience and new approaches in the field. And I know that you've published what I would consider revolutionary work in peer-reviewed medical journal articles, where you've actually shown growth in terms of the sizes of people's brains. How did you come up with that idea that, brains could grow? Is that something you had read about, learned about elsewhere, or is that something that is that a concept that you have sort of pioneered?
Well, this concept has been well described since 1960s. Brain reserve, brain plasticity have been known for centuries, but have been pretty well described at least since the 1960s. And when I was writing my first book, The Memory Cure, I read more on the topic, and I discovered that when we talk about neuroplasticity, we have to appreciate that the changes in the brain are not limited to children. For the longest time, we used to think that it's a children's brain that can grow and flourish and have more synapses and become bigger and stronger. And that as you grow older, that property fades, and of course, by the time you're 70s or 80s, it doesn't exist anymore. And there was a groundbreaking research by Fred Gage that showed, in fact, adult brains can grow new neurons. This was revolutionary. The idea that you can grow new neurons at any age was something that people thought would not be possible. So these were some initial research findings that got me really fascinated about our brain's ability to change at any age. And then I went on to write several research articles in peer-reviewed journals about all the factors that can shrink your brain. And I thought it was really interesting that obesity, hypertension, insomnia, sleep apnea, concussion, so many factors can shrink the brain, and especially the hippocampus, the memory part of the brain, in a dose-dependent manner. So the bigger the belly, the smaller hippocampus in a dose-dependent manner. The worse the diabetes, the more the hippocampus shrinks. The worse the anxiety, stress, the more the hippocampus shrinks. So I appreciated that medical conditions can negatively impact the brain. But then in about 2000 and 2003, 2004, new evidence started to emerge to suggest that there are things you could do to grow your brain within months. So for example, if you walked 45 minutes 3 times a week, you will see noticeable growth in your hippocampus. I remember this was a jaw-dropping discovery. Not just changes at the synaptic level, but at a macroscopic level. And then I learned that, for example, meditation can grow the brain, that certain diet can help the brain grow. And then I thought, I need to put these things all together in a book. And that's when I wrote my third book, which was Boost Your Brain. And I explained all this recent literature in an easy to follow and understand manner for general public. And in parallel, I started to put a program together that focuses on reducing the negative things in my patients that usually end up shrinking their brain and helping them grow their brain. For example, I think the key to my success was I just didn't tell them go exercise. I would tell them, listen, do you want to get better? If they said yes, I said, would you be willing to walk 5 minutes for me? I said, sure. And I realized that what I do is similar to physical therapy for the brain, that I cannot just work as a physician, talk to the patient for 15, 20 minutes, and have the patient come back 6 weeks later. It needs to be repetitive. It needs to be weekly. So then I designed a program where people come 2 hours a day, 2 days a week for 12 weeks. And we reinforce things about diet, exercise, learning, which supplements are good, and work with the patient to gradually change their lifestyle So by the time they finish, they're sharper, they're healthier, and their memory is stronger.
Wonderful. Wonderful. So I was talking to a group of doctors recently that are all treating various degrees of Alzheimer's and memory problems, and are looking at a variety of factors that are believed to be influencing them. And one doctor in particular was saying that he was seeing over and over sort of very plastic, meaning back and forth, very, very plastic type of observations with diet and exercising. In particular, he'd seen a few patients that had actually, on days where they were exercising and eating right, they had improved memory, cognition, understanding. Their words were coming out clearer. And on days where they didn't, they had noticeable increase in their symptoms of memory impairment, etc. Have you noticed that? Have you seen that there's such sort of fine tune? It's like fine tuning a radio.
There have been several studies that have shown how exercise can boost brain performance in general. One study that was published, I think it was JAMA, showed that if you do 10,000 steps a day, the benefits are 4 times more effective than Aricept. And so...
And Aricept being a drug that's supposed to improve memory and is approved for Alzheimer's?
Yes. And so several studies have shown that exercise, especially exercise, is very powerful for improving brain function in patients with mild cognitive impairment or even mild Alzheimer's disease. Other studies have shown that when children exercise in the morning, they perform better at their classes that day. And other studies have shown that kids who are fit and strong have a hippocampus that's 12% larger than the kids who are not fit. Not obesity, whether they're fit or not. So there's compelling evidence that exercise makes a huge difference, both in the short term, on a day-to-day basis, and in the long term, from months to years.
Okay, interesting. Majid, you've mentioned the word the hippocampus, which of course is part of the brain, but can you kind of describe where it is, why it seems to be important in development of a brain, and why it seems to specifically be important in Alzheimer's disease and what we know about it?
Yes. So hippocampi, one hippocampus on the right, one hippocampus on the left, are not far from your ears. So if you were to picture somewhere space between your ear and your throat, and something the size of your thumb, that's roughly where hippocampus sits. And just like you have right hand or left hand, or right eye or left eye, you have one right hippocampus and left hippocampus. They both seem to be doing similar things that have to do with memory. We think that the left hippocampus may be more closely associated with verbal learning, and right hippocampus with navigation and spatial learning. But these structures are very important for short-term memory, for you to acquire information and consolidate it so that if I ask you again 20 minutes later, or half an hour later, or a day later, you'll remember it. So hippocampus is a key structure that helps you get the information you hear and sort of bring it in your brain and register it, to consolidate it, to make sure it's still there. So hippocampus has many unique features that the other brain structures don't have. For example, hippocampus is very vulnerable to a lot of things that happen to us throughout life. So if you have high blood pressure, if you have obesity, if you have too much stress, if you have depression, if you have concussion, hippocampus shrinks out of proportion to all other brain regions. There are some hypotheses as to why that may be. When the blood vessels that go in the brain have special protection around them such that the material in the blood cannot easily access the brain. And that's a good thing. You don't want everything that is in the blood reach the milieu of the brain cells.
The blood-brain barrier?
It's called the blood-brain barrier, yeah. So researchers have recently discovered that the blood-brain barrier is leaky in hippocampus. And it's leakier the older you get, and the integrity is the least, is the leakage happens the most when patients have developed cognitive impairment. So that may be one reason why so many lifestyle factors, medical conditions, have a profound effect on the size of the hippocampus. So the other important concept is that when it comes to hippocampus, size matters.
Mm-hmm.
People who have large hippocampi do not develop cognitive impairment even if they have Alzheimer's pathology in their brain. This has been shown in several studies, and it's good to know because you have the ability to grow or you shrink your brain throughout life. And with your lifestyle choices, with the idea that whether or not you manage your obesity, your smoking, your hypertension, and so forth. So these factors, doing more of the good things and taking care of the bad things, determine the ultimate size of hippocampus for you. And if your hippocampus is large and strong, by the time you get to your 60s, 70s, 80s, you're less likely to become demented. So in summary, hippocampus, I think, is the ground zero for short-term memory and consolidation of memory. Hippocampus is the part of brain that determines whether or not you get Alzheimer's disease. If your hippocampus shrivels, you get Alzheimer's. If your hippocampus is big and strong, you don't get the symptoms of Alzheimer's disease, even if you have some footprints of Alzheimer's in your brain, including your hippocampus. So it's exciting structure in the brain. And recently we've learned to actually measure it in millimeters and monitor it, which I do in my clinic.
Excellent. So how do you do that? Is there a simple way to do that that's covered by insurance or something like that?
Yes. One company provides volumetric measurements of hippocampus. It's called Neuroquant, Neuroquant, Neuroquant measurements. Other companies are starting to introduce similar products. So in a few years, there will be some competition for Neuroquant. But for now, you write, when you write the order, you write the brain MRI with Neuroquant, and insurances do cover it. I believe that for now, the company, the radiology offices do not charge extra when they do Neuroquant. But I imagine that in the near future, we'll add $100 or so for doing this extra data analysis to give you the exact measurements of the hippocampus.
So that's interesting. So maybe to clarify a little bit. So as I understand you're saying, so MRI is a technology somebody can get an image of their brain in an MRI machine, and then there's an overlay or a separate software piece that then analyzes different structures of the brain, possibly compares them to some sort of normal value, and then gives them like a grade, how big their hippocampus is, for example, or other parts of the brain compared to like an average for their age. Do I have that correct?
That's correct.
Very interesting. And so that's something that's fairly readily available to pretty much anybody.
The only thing is that Neuroquant is not universally available in all radiology offices across the country. Mm-hmm. There needs to be a neurologist or psychiatrist or geriatrician who orders these in order for the radiology offices to pay the company that provides the software, the Neuroquant software for them. So I do have patients who come from other towns, and when they go back to their towns, especially if they live in a small town, their radiology offices may not have made a contract with Neuroquant. Okay. But I can imagine that within 2 or 3 years, there will be at least 1 or 2 radiology offices in every medium to large city where you can get Neuroquant.
Excellent. Yeah, I know it's fairly standard, our institution, but we're a large institution, so I have patients that sort of face the same thing when I need to get these images on somebody. So that's the measurement side of the hippocampus, but possibly more exciting is, you've published on growing the sizes of people's hippocampus, and how does somebody do that? What are the elements? You mentioned diet and exercise and meditation and stress reduction. And is it that simple?
Well, the reason I thought that it is possible to grow the size of hippocampus in my patients is because I had reviewed the literature and I saw that many studies have noticed an expansion in the volume of hippocampus with different interventions. And I argued that if each intervention can expand the size of hippocampus by 2%, 5%, 7%, if you put together a program that will provide all these interventions under one roof, and more importantly, if the program is structured such that patients will receive close monitoring and encouragement to stay on track, you should see more robust benefits in a short period of time. For example, studies that have shown exercise is beneficial show that walking 45 minutes 3 times a week increases the size of the hippocampus in 6 months and in 1 year. Another study has shown that if you start a vigorous program of exercising, your hippocampus can grow by a significant amount in 3 months. If you treat sleep apnea, your hippocampus can grow in 3 months. If you meditate, your hippocampus can grow in 3 months. And if you have a Mediterranean diet and take omega-3 fatty acids, hippocampus may have very subtle increase in the size, not huge. So I sat down and I put together a protocol that contains all the important things that I had reviewed in the literature, and I did not include things that did not have placebo-controlled backing of studies. So the science-based program and individual components have been shown to grow the size of the hippocampus. So I argued that if you put them all together, you should see results in a shorter time, and it's exactly what happened. So the results was really impressive. I must say I was even surprised myself. I knew it would work, but as much as I knew it would work, it actually worked better than I thought. You know, we get people in their 70s and early 80s mostly who have a condition called mild cognitive impairment. These are folks who forget a lot, repeat themselves, but they're not exactly demented. They still drive or shop or participate in social gatherings, but they repeat themselves. They ask the same question 4 or 5 times. And so they are really on a slippery slope to develop full-blown Alzheimer's disease, and they're not normal. And there's no FDA-approved medication for these types of patients. No other study has shown noticeable improvements in their memory or other aspects of cognitive function. So in this population, we studied 127 patients, and over 3 months, 84% of them had statistically significant improvements in memory, attention, concentration, or other aspects of cognitive function. And these were based on a standardized battery of cognitive tests. This was not based on self-report or some questionnaire. These were based on standardized battery of cognitive tests.
Right. So these people were evaluated and confirmed that they had some sort of a measurable memory loss before they started your program.
Yeah. So we did a cognitive testing,
right,
on them at baseline, and we've determined that their attention is, let's say, 5 percentile compared to people their age. Their executive function, their ability to solve problems and do multitasking and so forth is at 10%. And their processing speed was, let's say, 12%. These are all cognitive performances that are below average. And then after 12 weeks of interventions, the processing speed was 55%. And wow. Attention was 60%, and executive function was 55%. So there were significant improvements, and they were so much better that some of them no longer met the criteria for having mild cognitive impairment anymore. And there were things that we noticed which were not captured these tests. For example, I had a patient just yesterday who finished the program, a 12-week program. He's an 84-year-old gentleman. Very nice. He was brought to me by his wife, who said, we've been married for 40 years, and the thing that I love about him is that he is so witty. And we used to talk about everything, and conversation was really something I enjoyed with my husband. But for past 2 or 3 years, he doesn't talk much. He just sits there and he doesn't say much, and he does forget things. He repeats himself often, and he's not interested in doing things, and he does do some volunteering work, and he does exercise, but he doesn't talk. And so she was frustrated, so frustrated that she was thinking of leaving him.
Wow.
And when they came, I said, look, no promises. We do our best. 84% of people improve significantly, and we'll make sure that he'll be one of them. But, I want you to know that this is not standard of practice. This is not what other people do in their practices, but we'll give him our best shot. So he went through the program, and he was very nice. My staff enjoyed talking with him. And week by week, he improved. And then he finished the program early January. And so today, they'd come back to just talk about his post-program test results. And it was so exciting because all his cognitive functions had improved. His attention had gone from 12 percentile to 60 percentile. His executive function gone like 20 percentile to 70 percentile. Every cognitive function had improved. Also, he was talking more. I loved talking to him. I had seen him the first time. The first time he came, he just sat there, and the wife did all the talking. And he was like a child who was dragged to a doctor's office.
I've seen that before, sure.
And today, he was talking, he was cracking jokes. He was engaged. He was conversational.
She got her husband back.
And she got her husband back. Wonderful. I felt so good. And I did not start him on any new medications. It's not like I put him on antidepressant or anything. He was, he only takes lisinopril. That's the only thing he takes. So, it's wonderful to see that an 84-year-old could improve. And now that he is more confident about his ability to talk and participate, they're doing more things. So he's excited, she's excited, and I'm excited because this thing works. And I really hope that we can make this program available for people all across the country, because nothing I do is rocket science. There is actually one exception. We do something called neurofeedback. And neurofeedback is a biofeedback therapy that uses your brain waves as a feedback to you so you can improve it. Put it simply, we first do something called brain mapping with electrodes looking at your brain activity. And we can tell that, parts of your brain are too active or not active enough. And then for treatment, we put a few electrodes on top of your head. These are similar to the EKG sensors that doctors use to look at EKG. And we use these sensors, similar sensors, to put on the brain, and it's called EEG, electroencephalography. And then we show you a movie. And the movie is your reward. So your brain has spontaneous oscillations. And when the oscillations approach normal, you get rewarded, and your reward is the movie to continue. And if your brain waves, the oscillations don't move toward normal, then the movie stops. And when the movie stops, that's the clue to you, to your brain specifically, that you're not moving in the right direction. And that sort of kicks back in the brain activity to move toward normal. I find this really fascinating. And there are many, many placebo-controlled studies that have provided convincing evidence for treating patients with attention deficit disorder, particularly with neurofeedback. There are also studies that have shown neurofeedback is helpful for anxiety, insomnia, and migraine, but not as strong as the data that shows that neurofeedback is really helpful for improving attention. So that's what we do. We do diet, exercise, counseling for stress reduction, time management. We do memory drills. We show our patients how to memorize 20, 40, or 60 things. And twice a week, we provide them with neurofeedback therapy, which is 1 hour, let's say on Monday, 1 hour on Friday.
So does everybody gets neurofeedback in your program?
Yeah. I had initially set 3 levels of the program. Level 1, level 2, level 3. Where level 1, somebody who's really good, let's say you come to me, say, Majid, I'm good, but my memory is not as good as it used to be. We do our assessment and we find that your memory is at 72 percentile, but knowing you and the fact that all other cognitive domains for you are 95 percentile, your memory is not up to par with the rest. So we give you 4 hours of memory drills, memory training, and that's it. So we show you memory skills. And people need to appreciate that memory is a skill we can learn. So there are ways we can teach people how they can improve their memory. It's not like you're born with it, and if you have no good, your memory is not good, it will never be good. Your memory can improve. So patients who have only selective memory problems, otherwise they're exercising, they're sleeping well, they don't have stress, we just give them 4 hours of memory training. And then there are people who may have somewhere in between severe memory loss or other concerns and subtle ones. And for them, we have sort of a once a week program. And the majority of our patients, though, have multiple complaints and multiple findings. So the majority of our patients get 4 hours of training every week, let's say 2 hours on Monday and 2 hours on Wednesday. One of those 2 hours is neurofeedback, and the other one is what we call brain coaching, which is providing cognitive training, providing counseling for diet, exercise, sleep, and talking about stress management and organizational skills.
Wow. So it's really comprehensive. I mean, it's looking at almost every single sort of lifestyle domain that one could imagine. Stress, exercise, obviously eating, and then the overlay of neurofeedback, which I'd love to talk to you more about. You mentioned brain mapping. What's brain mapping?
When you do an EEG in a neurology office, we often look for spikes, which is these sharp brain activities that are associated with seizures. But you can obtain a full set of electrode recordings and look at your brain activity, not to look for spikes, but to see if compared to people your age, you have too much of any particular brain wave activity or too little. Your brain is like an orchestra. You have tubas, you have violins, you have flutes, and there's a harmony in how all these brain waves in different parts of the brain talk to each other. There's a normative database that shows how much of these we're supposed to have. Just like there's a normative database for cholesterol or normative database for what's a normal thyroid level. Now we have a database that tells us what's a normal brainwave pattern. So when a person comes for evaluation, we do a brain MRI. That looks at the brain structure, whether your hippocampus is big or small, but it doesn't say whether your brain is too active or not active enough. We do cognitive testing, which measures your memory, your attention, your concentration, and we do brain mapping. And brain mapping is sort of listening to the brain with the brain language. Are you having too much of alpha waves, which are sort of mid-ground levels? You have too much of delta or theta activities, because these are the slow wave activities, or you have too much of high beta, which are the fast activities. So do you have more tuba, you have more violin, or you have the right balance of these things? So brain mapping gives us these pictures that are similar to the PET scans or SPECT scans, which have also been done in recent years to look at brainwave activity. But we use EEG, which is much cheaper than a PET scan or a SPECT, and it provides similar results.
So that's the way that we look at the functioning of the brain. That's the brain mapping in terms of the looking at all the different waves and together so that they're sort of in harmony. And then the training that you're doing, that you're talking about once, twice, or more a week. So that is to train the brain to sort of be harmonious in terms of its waves together.
Yeah, and that's the interesting part. So it's like you set up a conversation with the brain. You tell the brain, look, you're going too fast. If you slow down just a little bit, I'll get you a reward. And so the electrodes you place on the patient's head record the brain activity, and that is hooked to a monitor where a movie is shown. We can also set up some games like a balloon going up, and the more rewards you get, the more the balloon goes up. And use this system is millisecond by millisecond by millisecond. It's a live feedback as how your brain is doing. And so your brain has a spontaneous up and down activity, and every time it moves toward a normal, the movie continues. But the moment that it's the millisecond that the brain stops moving in the right direction, or if it goes the opposite direction, let's say somebody has too much high beta, and we want to teach your brain to reduce that high beta. And your brain has some spontaneous activity within that range, and it needs to come down. So when it comes down one little notch, the movie continues. And then it comes down one little notch, the movie continues. And it usually happens, the reward happens like 250 times per second. I mean, it's a millisecond by millisecond. The adjustments are tiny, tiny, tiny. But then let's say your high beta, for some reason, goes up. Well, this is not the desired outcome. We want your brain to calm down. And when it goes up, the movie stops. The movie fades and then stops. And that's a reminder to your brain that you need to calm down. Now, the reason we know this is working is because while you're watching the movie, we are watching your brain waves. We can tell that your high beta is coming down, it's coming down, it's coming down, it's coming down, it's coming down. And also we can look from session to session. Let's say you start with 90% high beta waves, and then you have 80% high beta wave. And you have
those beta waves are fast waves, faster waves than usual.
Right. So you can see if these fast waves are just coming down, and every 6 weeks, we do a sort of a complete 19 electrode EEG at the beginning, and one in 6 weeks, and then at the end.
And that's
at
the map.
6 weeks, we can see that your brain has already started to improve.
In 6 weeks?
Yeah, in 6 weeks, you can see changes in the EEG. And of course, the changes in the EEG can happen before there are changes in behavior. You have to have so much change in your brain before that gets translated into a change in your behavior. So that's why we see changes in the brain before a person's memory, attention, or mood improves. And then, there are protocols. There's a science to it for these different protocols. And sometimes we have to tweak the protocol, or, when we put the electrodes on the head, we have 4 electrodes, so we can move the electrodes and put them in hot spots. So it's the bottom line is your brain can increase or decrease its activity based on the feedback it gets. And we can do that. Now, what's really interesting is that one study showed when you do the protocol for increasing attention in patients with attention deficit disorder, the parts of the brain that are important for attention grow in size. So parts of the frontal lobe literally are bigger. When you do MRI at the beginning and at the end, and you provide only neurofeedback as an intervention, not a full program, just neurofeedback, parts of the frontal lobe are actually larger.
Amazing. So with neurofeedback, you're getting both structure and functional differences that can be measured just with the neurofeedback as the sort of exercise.
That's right. So you see that your brain map improves. And now, just to be fair, one study has shown growth in the size of hippocampus. By the way, that study didn't show increase in the size of hippocampus. It showed increase in size of frontal lobe. Which makes sense, because if you have a protocol to increase attention, then the parts of the brain for attention will respond. I think there will be more studies to look at changes in brain structure with neurofeedback. But it makes sense because, if you do meditation, when you meditate, you're trying to do sort of anxiety-producing high beta waves yourself. You're repeating a mantra, and your mantra is your way of reducing the fast activity in your brain. It's not high tech, obviously, because you're doing it yourself. Mm-hmm. And it's not millisecond by millisecond, because you may get distracted and it would take a while before you get back on track. But it is somewhat similar. And neurofeedback by itself has been shown to grow size of hippocampus and some other parts of the brain. For neurofeedback, there's more studies where they've looked at brain structure. Some studies have shown that the cortex is thicker, the part of the brain for thinking and long-term memory is thicker and denser. Other studies have shown that hippocampus is literally bigger. And so if meditation can do it, it makes sense to me that neurofeedback should be able to do it too, because this is a more structured way of modulating your brain activity. And to my knowledge, one study has shown changes in brain volume, and I expect that there will be more of them in the future.
And you're also, though, just to clarify, in your program, the 12-week program, you're also teaching people to meditate as well?
Yes. So when they come, let's say you come to my program and we set up something for you Mondays and Wednesdays. On Monday, let's say from 4 to 5, you have brain coaching. With your brain coach, we do talk about diet, exercise, sleep, stress reduction, meditation training, time management, organization skills. Now, because different people have different strengths and weaknesses, they may need work on aspects of all these things I just mentioned to you, not all of them. For example, this patient I told you, 84 gentleman who came for post-program follow-up, was already exercising. So we didn't have to talk to him about why didn't you walk 45 minutes, and he was already doing it. And he was also already doing some volunteering work. So with him, we had spent more time on memory drills, and we talked more about, putting more activities in his day such that he will be busier and more engaged in day-to-day life. And we work on his language. We sort of gave him brain games that stimulated his vocabulary and his ability to come up with words. The brain game that we use is similar to Lumosity. It's called Happy Neuron. But this is not some random set of games. These are like physical therapy exercises for weakness in the right shoulder versus left knee. We tell you what to do, and we monitor your progress based on the abnormalities that we noticed in your cognitive test. So if a cognitive test showed you have a lot of problem with organization skills and attention, then we will give you brain games that improve those parts of the brain. So then, what happens is day one, you have 1 hour of what we call brain coaching, where you get a combination of these things I told you. And we set a priority at the beginning. So if somebody has diet as the main issue, at the beginning, we work with diet. And after 3 or 4 sessions, we get a diet thing straightened out. And then we move on to another subject. Or we do half counseling for diet and half brain training, where we do 20 minutes of neurofeedback, 20 minutes of meditation, and 20 minutes of memory training. So each of the brain coaching sessions are individualized. In other words, we don't do exactly the same thing for every person, because each person is different. This gentleman I told you is very different than his wife. His wife.
So it's not just out-of-the-box therapy. Everybody gets it sort of personalized, individualized to what's going on.
The first hour is brain coaching, but the second hour is neurofeedback. And the neurofeedback is tailored for individual patients based on what we saw in their initial brain map.
Based on the music in their own mind.
Yes.
Trying to get them more harmonious. I love that analogy, Majid.
It really works well for attention, Nate. We do have in my clinic patients who have attention deficit disorder or adult attention issues.
Sure.
And I've been so impressed by how many people are surprised by their own improvements. They say things like, my God, I can't help but to finish something I start to read. Whereas before I would start read, and then before I knew it, I was looking at the TV, I was checking my iPhone. But now when I start an article, I actually read the whole thing. Or I used to be scattered, but now I'm more organized. And to the degree that they are just surprised because people think it is what it is and they're not going to be much better. And then they improve so much and they're very pleased.
That reminds me of, I heard from Dr. Dale Bresden, who I know you know as well. He's doing bench research and animal research in the Alzheimer's and memory fields and other diseases as well. And he told me about an animal condition that was designed as Mouseheimer's, right? And even some fruit flies flies that when you induce in them changes that appear to be like Alzheimer's, they actually at first appear to be having attention deficit type of symptoms before they sort of manifest into full-blown Alzheimer's, which is interesting in terms of what you're saying, like almost early, like mild cognitive impairment pairs with, or part of that is, in many cases, of course not all, attention issues, which begins to create more problems with working memory and people's ability to kind of do what their normal life used to be like, read an article, have a conversation with multiple people, sometimes talk on a phone, sometimes even following a TV show that's complicated or heady.
Yes, and it goes back to what we started, which is your brain has capacity to change, and each part of your brain can grow. There's a very nice article by an author in Germany. Her name is Arne May, A-R-N-E, last name May, M-A-Y. She wrote an article, and the title is Practice Makes Cortex.
You will post that in the show notes. Thank you.
Yeah, and it talks about how so many different things can stimulate different parts of your brain. And there's scientific evidence that those things literally grow particular parts of your brain. So if you, for example, take a music lesson and practice violin intensely for 3 months, parts of your brain for music, for movement, for coordination, literally grow. If you even take 70 hours of golf lessons, parts of the lateral frontal lobe grow as compared to when you started your lessons. If you memorize a lot of new words in a language, and if you, let's say, learn Spanish or Italian or Japanese intensely for 3 months, your hippocampus grows. So cortex and hippocampus together can grow remarkably quickly within 3 months of intensive treatment. And so that's what we do. We say we want to focus on your hippocampus because this is the part of the brain that's important for memory and risk for Alzheimer's disease. So we do that. And the thing is, from a scientific point of view, we've learned what are the ingredients that constitute the extra volume in the hippocampus, for example. One of the questions I get is, well, when you say hippocampus gets bigger, what's in that extra volume? What's bigger? And there are 4 things. There's increased neurogenesis, increased production of new neurons in the hippocampus. There's increased number of fibers. There are more dendrites and axons, more connections from hippocampus to other parts of the brain and other parts of the brain to the hippocampus. There are more synapses, there are more contact points between neurons, and there are new blood vessels. There's neovascularization. So we have an idea as to what constitutes the increase in volume, and we know that one of the key ingredients for growth in the brain, and especially in the hippocampus, is a molecule called brain derived neurotrophic factor, BDNF. And so we know, for example, certain supplements and factors that can grow that increase levels of BDNF. For example, we know that omega-3 fatty acids stimulate the levels of BDNF, which promotes growth in the brain. We know that caffeine, for example, is good. So we recommend 1 cup of coffee in a day and some blueberries and some omega-3 fatty acids, because these are the things that have been shown to increase the levels of BDNF. We actually tell people to take omega-3 fatty acids, which help to increase BDNF levels, but they're also been shown to help with stabilizing endothelial cells inside blood vessels. They improve blood flow to the brain and to the heart.
I've heard some people describe BDNF as miracle grow for the brain. Is that accurate?
I think it's true.
Yeah, amazing. So, Majid, let me summarize a little bit what I'm hearing from you. I mean, it's remarkably elegant what you've put together, meaning it's complicated but seems to come together in a quite straightforward way. You know, I'm sure that wasn't easy to organize all these pieces, but essentially it's dietary strategies. Specifically, you mentioned Mediterranean diet, blueberries, perhaps 1 cup of coffee a day for people that tolerate it, and for assuming that it's safe for somebody to take omega-3 fatty acids or fish oil, that would be the inclusion of omega-3 fatty acids. Exercise would be another thing. Stress management techniques, memory training, neurofeedback. And remarkably, if these symptoms are caught early enough, it sounds like you've seen, at least in 127 people, the study that you published, 84% of those people had measurable improvements in only 6 weeks. And in many cases, they had these EEG changes, meaning the brain maps that we talked about. Those people had changes in even 6 weeks, at least, that we're looking at when you're mapping their brains, and which is just astonishing. Do I have that right?
Yes. So I think another key to our success is that we monitor every patient every week. In other words, we have all these things under control. From a point of view of the patient, we do 1 or 2 things in each one of the brain coaching sessions. We may talk about diet or exercise. We may talk about meditation or stress reduction. But we have a master plan that we want everyone to follow. So we have what I've put together as a brain fitness calculator, which gives you a score for all these things I just told you. And so every week or every other week, we review those with our patients, and we make sure that the overall score for this brain fitness calculator improves as they go through the program.
Is that something that somebody could access online, like a brain fitness calculator, or do they have to come to your program to get that?
Yeah. No, it's available. I did this program with NBC's Today Show, and I put it on, and they asked me to put it on their website. And I actually will put it on our website. I will put it on my neurology practice website, Neurogrow.com.
Neurogrow, Neurogrow.
Neurogrow.com. I will put them within a week.
Excellent. The brain fitness calculator, so people can sort of monitor how they're doing.
Yeah.
Excellent. Majid, I'd like to shift directions for a second here, because you mentioned something earlier that I'm finding more and more of, and I'm in my own patients, and just more and more common. There's more and more awareness about concussions, traumatic brain injuries, and I know your expertise is not simply limited to memory loss and Alzheimer's. And one of the areas that you have deep knowledge in is traumatic brain injury. Can you tell us how traumatic brain injury and concussions, even if you're getting bumped in the head as a kid, where you saw stars, you got knocked out, can that impact brains as we get into our 40s, 50s, 60s, and 70s? And how do you sort of couch that or contextualize that when you're seeing people in your clinic?
Yeah, this is a hot topic. Obviously, a bang in the head, it's not going to make you become demented 70 years later. And so if somebody fell off a tree or got hit, playing football once, a single episode is not something that will have long-lasting consequences unless it was a major one. Like you had a huge bump in the head and you were unconscious for 4 hours and you were confused for days or something like that. Because our brain has a repair mechanism. The levels of BDNF go up after a concussion. There is increased blood flow. There's some inflammation and there's healing. So within a couple of weeks, 2-3 weeks, the brain heals. This is important for people to know and feel reassured that a benign bump in the head, or if they saw stars and they were like buzzed for a few seconds, does not mean that their life is over. What is problematic, however, when a person gets repeated concussions, they play football or rugby or hockey, and they get hit. They keep getting bumped into each other, and people think of concussion as the head-to-head collision, but even a body-to-body collision where your neck goes in and out, where your brain inside your skull is sort of jolted forward and backwards, even though you didn't hit somebody head-to-head. That's bad. One study published in JAMA in 2014 showed that college athletes who played football on average have much smaller hippocampus than college athletes who don't play football. And then among those who played football, there were some who reported concussion and those who said no, they did not have a concussion. Researchers found that even the group who said they didn't have concussion, they had a smaller hippocampus than the control group. And I think it's because the non-concussion athletes who played football still experience their head being smashed forward and backwards every time they were tackled or hit or fell. When I watch these NFL games, I just keep imagining what may be happening to the brains of these athletes.
I know. I cringe now when I see it sometimes.
Yeah, one bump in the head, it's unlikely to cause long-term consequences. However, repeated bump in the head, especially if they're severe, or even sports where there's body contact, even without direct head-to-head collision, they will be problematic. And studies have shown that when people have these major concussions, their levels of tau and amyloid go up in the brain. These are the same proteins that clump up in the brains of patients with Alzheimer's disease. And NFL players are 3 to 6 times more likely to develop Alzheimer's disease. And some imaging studies done by Dr. Gary Small at UCLA have shown that even young football players have high levels of this tau and amyloid in their brain. So in summary, athletes who have multiple concussions have so much abnormalities that the natural healing mechanisms that take care of things are not sufficient. And there seems to be a progressive cascade of events where some injury starts chemical process in the brain, which then accelerate rate of brain atrophy. And by the time athletes get to their 60s and 70s, they become demented at an earlier age than they would have otherwise. And so my program actually works well for concussion patients because in our program, we build the brain. We focus on the hippocampus, but as you know, cortex has high malleability as well, not to the same degree as cortex, but it's next in terms of how easily it can change. Remember I told you cortex practice makes cortex, because cortex can change. And the kind of things that we do, like diet, exercise, stress management, organization skills, brain training, all of those make the cortex bigger and thicker as well. I have lots of patients with concussion. In fact, these days I have more concussion patients than I have MCI patients because the program has been remarkably successful for these patients.
Well, the last couple of questions here. Who are the people, you've sort of described the people that are doing well in the program.
Yeah.
Who are the people that do not do well in your program, and who's sort of not a candidate?
I offer the program to patients who have Alzheimer's disease and they have progressed to the point that they don't know what year it is, they don't know the name of the president. I have discouraged patients to enroll in the program if they have that much deficits, because I think, unfortunately, they have had too much brain atrophy in their brain. And although what we do helps them feel better or be more attentive, they still don't know what year it is. They still cannot function. So I discouraged patients who have moderate to severe dementia. The other group I find in my practice who doesn't respond as well are people who have significant levels of psychiatric conditions, like really out of control anxiety or out of control OCD. Again, they do improve. Everybody says something positive when the time they finish program. It's really rare that somebody finishes the program and says, "Nah, it was a waste of time." It does happen. But maybe 1 or 2% of the time, somebody says, "Really, I don't notice any improvements." And interestingly, because we do cognitive testing on everyone, and because we do brain mapping, we have objective data on our patients. And it's really rare for people to have not improved in cognitive test results. I encourage patients to start my program if they have MCI or they're pre-MCI, like people who have forgetfulness but not severe, and for patients who have concussion. There's a condition called post-concussive syndrome, where for months or even years, you've had nagging symptoms of headaches, sensitivity to light, sensitivity to sound, irritability, difficulty sleeping. And we found that our program works well for this patient population. I'm collecting data for our patients, and we have sort of made some specific variations for this population, and we actually call the program Concussion Recovery Program, because many of these patients have dizziness and vertigo and migraine, so they need specific attention to those issues. So it's not exactly identical to the brain fitness program. I hope to gather this data and hopefully publish it in about a year or two.
Wow, so exciting. So you're doing what I would call the heavy lifting. In other words, a lot of people out there are sort of claiming results and saying they're getting results, but you're publishing and allowing this work to be reviewed by your peers in the medical and scientific community. How has your work been received amongst your peers in the sort of called the mainstream medical community so far?
Mixed responses, I must say. People like you who appreciate what I do and understand the science of what I do are supportive. But there are also people who believe that the reason you become demented in late life is because you have too much plaques and tangles, too many accumulations of tau protein and amyloid, and anything that you do is really touching the surface. The real solution is to find a vaccine against these proteins. And so they may look at me politely and shake their head like, interesting, but inside they're thinking, you're wasting your time. I had somebody who told me that actually is an investor who is working on a company to make a vaccine against amyloid. And he said, well, I hope you have a lot of patients this year, because next year we'll have a vaccine and nobody's going to come see you anymore.
Okay.
Because we will have the problem solved.
Well, that would be great. I'm sure you'll take it.
And I thought, people need to realize that even if you have a vaccine against plaques and tangles, because plaques and tangles are not the sole cause of memory loss in late life, they may have mild benefits at best. I think those vaccines will help young patients, with Alzheimer's disease, people in their 40s, 50s, or early 60s. But for grandmother or grandpa who's in 80s, I think these vaccines will not have any benefits.
Well, Majid, thank you so much for your time. It's just amazing the contributions you've made. I really appreciate your offering to be here and talk with our listeners. Thank you very much.
Yeah, it's my pleasure. Thanks for inviting me to.
And just so the way that our listeners can find you is on, www.neurogrow, NEUROGROW.com. And how could, if somebody wants to enroll in your program or become a patient, how could they do that?
Yeah, so there's contact information on the website, and the email address is info@neurogrow.com. And our office number is 703-462-9296.
Excellent. Majid, thank you so much. I really appreciate it.
Yeah, my pleasure.
So that's our episode. I hope you guys got something out of that. Check the show notes out on iTunes or on our website where we've summarized the key points. If you have questions or comments or just want to connect, please check us out on our Facebook page. Or if you're old-fashioned like me, Google Evolving Past Alzheimer's Podcast, and you'll find us that way. Finally, if you find the information here valuable, please consider giving us a 5-star rating on iTunes and leaving comments in the comments section. It will really help us bring this message to as many people as we can. Thanks, and talk to you next time.